Hello, this is Alec Hamilton, Fire Chief for Oxnard Fire Department, and I'm very excited today to be bringing forward for the Public Safety Committee's consideration the Oxnard Emergency Ambulance Services contracts. I will tell you that we have been nothing short of a Herculean effort to bring all this work forward to you for consideration today, and very much appreciate the work of the entire city, including the finance department, the city attorneys and city manager's office have all done a lot of work in addition to the fire department to bring this forward to you today. So the staff recommendation is for the committee to recommend City Council approve and authorise the Mayor to execute an agreement with Falck Mobile Health Corporation, or Falck Ambulance, for 3 years with an option to renew for 2 additional years. Additionally, we'd like to approve and authorise the Mayor to execute a purchase order for the procurement of 10 paramedic monitors and 10 StairPro stair chairs to be placed on these ambulances. And finally, for the city manager to be authorised to approve and execute amendments to the Falck agreement. So to provide a little bit of background, ambulances in the County of Ventura have been governed by a Joint Powers Agreement, or JPA, since the early 70s. And that has been how ambulances have been coordinated. For the city of Oxnard, those services have been provided from 1971 through to 2010. The ambulance services were provided by Gold Coast Ambulance. Prior to 2010, Gold Coast was a small business that was locally owned and operated. It's also worth noting that the city of Oxnard is part of a wider area that you can see in the map there of what is known as Ambulance Service Area 6, or ASA 6. So it also includes not only Hueneme, but also not only Oxnard, but also Port Hueneme, El Rio, the naval bases, and then you can see there other unincorporated areas down to the county line. Historically, Gold Coast compliance with response times was very high. As you can see there, in 1996, it was 99%. And then in 2010, it had dropped a little bit, but was still over 96.5%. In 2010, Gold Coast was purchased by American Medical Response. That's not initially, but that's when we really started to see a decline in service, to the point that by July of last year, compliance had dropped to just under 91.5%, and that's with exemptions that we have talked about previously. What ended up happening by AMR purchasing Gold Coast Ambulance, it allowed the AMR to move ambulances in and out of the area known as ASA 6 into other ambulance service areas. And what that meant is that we saw an increase in late responses by ambulances. And so the top map that you see there, that is calls where the ambulance was over 8 minutes in responding. And you can see the red then going into yellow is the highest density of those late responses. And then the second map below is actually responses that were over 15 minutes. And again, you can see the yellow is where the majority of those late responses are. And you can see that they're very focused in the south end of Oxnard. And so in 2017, when we started really looking at and analysing the delays in the ambulance's responses, we very quickly found that the highest volume of delays happened in the lowest income neighbourhoods. And so again, this map here it's a little busy, but basically the darker shaded areas is where we had the highest percentage of late responses. And so out of frustration and the fact that we weren't able to have this situation adequately dealt with through the EMS agency, the Oxnard Fire Department was awarded a community development block grant to help address the issue. And we were able to address the issue through starting the Oxnard Fire Department's Advanced Life Support or Paramedic program. And so we started that in 2018, and we saw an immediate improvement in response times, particularly to the south end. And another thing that's obviously changed the way we operated has been the pandemic, and the pandemic had a major impact to the private ambulance providers' revenues. There was a drop in 911 responses when the first lockdowns occurred, although those our responses went back to normal levels, as you can see, by September. The other issue that happened for the ambulance companies was that there was a significant drop in the non-emergency transports, or IFTs. And so in response to the drop in the non-emergency transports, we ultimately saw a reduction in the number of 911 ambulances that were available. And so for Oxnard and for ASA 6, there was a drop. They dropped one of the 24-hour ambulances. And so as the surge that occurred beginning in sort of October and really started to accelerate into November and December, we saw an incredible increase in call volume. As you can see, that bullet point there, it talks about the early estimates show an approximate increase of 13% in cardiac arrest responses in 2020 over 2019. And I can tell you the vast majority of that increase actually occurred in the last 2 months of the year. So much so that the city manager authorized the immediate deployment of all Oxnard Fire Department paramedics, whereas routinely we would have 1 or 2 on duty on any given day. We put them all in service to help respond to the radical increase in EMS calls that we had. And just a little bit more background for those who are watching. On December 1st of 2020, the Oxnard City Council directed the city manager to give notice that we were going to withdraw from the JPA and that we were going to take over local control of managing the ambulance service within our city, in part due to the issues that we were having with the county-run ambulance system. And so once those notifications were made, the fire department immediately went to work to develop a formal bid solicitation for ambulance transport services. And as you can see there, it was our purchasing department helped put that RFP together. It was accessed by 19 different ambulance providers, the RFP documents. We also sent invitations directly to 10 different ambulance providers, 4 of whom chose to participate in the mandatory pre-bidders conference. In February 26th of this year, we put together a 5-person panel to evaluate the bids. And you can see there the list of the panel that we had. Ultimately, that panel came up with a recommendation that Falk Ambulance was responsive and has the expertise to be able to provide the services for the city of Oxnard. So as you can see there, they're one of the largest ambulance companies in the world. They have multiple 911 contracts in San Diego, Orange, Los Angeles, as well up in Northern California, Alameda County. And so they're very good at and have done similar work in similar sized cities and systems. And so we feel very comfortable that Falk Ambulance is going to be a great partner for us moving forward. And so part of what we wanted to also just highlight was the deployment model that we have built using our GIS, the city's GIS folks. We've been able to put together a deployment model to make sure that we have adequate coverage throughout the city. And so you can see, again, these maps just kind of highlight where we will be able to place ambulances and how they'll be able to cover the areas. And you can see there, on the map on the left, everywhere in the green, it shows that where an ambulance can get to within 8 minutes. And so you can see we've got some excellent coverage with those ambulance stations spread throughout the city. One of the things that I want to reassure everybody is that we will be improving the system in part because these ambulances that we will be deploying will be dedicated to 911 responses only. They will not be used for any non-emergency transports, and they, while we'll still work within the county-wide system, we'll have more control over if an Oxnard ambulance has to move to a different jurisdiction to help cover that area. And so from this contract, we'll have 9 operational resources. So there'll be 4 24-hour ambulances, 3 12-hour ambulances, a paramedic supervisor will be on duty 24 hours a day, and then there'll also be a clinical ops manager that Falck will provide. We will have, as you can see there, the ambulances, the Type 3 box ambulances. They're a larger unit than the van-style ambulances and allow for better patient care while patients are being transported to the hospital. So what this, by taking back local control of the system, what this allows Oxnard to do is really develop a much more robust system where we can really look at focusing on metrics that produce better patient outcomes. And so one of our goals immediately is to improve the current response times from 8 minutes 90% of the time to 7.5 minutes. And really what we'd like to get is advanced life support or a paramedic on scene within 5 minutes, 90% of the time. And so for Falck Ambulance, what we've asked of them is that they, within 60 seconds of receiving a call, they need to be on the road and driving towards that call, similar to what the fire department does. And then if it's past 11 o'clock at night, between 11 o'clock at night and 6 in the morning, they'll have 120 seconds to get on the road driving towards the call. And so we're not so much focused on how long it takes them to get to the call, as we just want to make sure they get on the road quickly. And then if we need additional ambulances to continue to improve our response times, we'll be able to add additional units. And so, as I mentioned at the beginning of this presentation, we talked a little bit about the equipment procurement. And so one of the things that we are working on, we managed to get an excellent 0% financing agreement to be able to purchase these LifePak paramedic monitors. And so they can do a full range of clinical interventions, diagnostic procedures. They're the same units that our current fire department paramedics use. And then additionally, the StairPro stair chair just allows the fire department and the ambulance company to transport patients, particularly if they're in an upstairs apartment or upstairs room. It's a much safer way to get those patients downstairs and down from steep angles, steep inclines. So the projection for the first full year of the contract with Falck Ambulance, and this includes all startup costs, and this would be scheduled to begin July 1st of this year. We are estimating our contract with Falck will cost around $7.1 million. And so the appropriation will be in the 21-22 budget. And then we are estimating a cost recovery reimbursement of approximately $9.65 million. Collections on reimbursements will run behind approximately 3 to 6 months on initial startup. So there will be some amount of seed money that will be used to get the program stood up. And again, for purchasing the medical equipment, we have a 0% financing arrangement. over 3 years, and the cost recovery from transport user fees will cover the purchase costs. So in the first year, you can see there will be the first annual payment of $152,000, as well as the tax on the entire purchase of $33,000. And so the total cost of all the medical equipment, as you can see there, is just over $492,000. And with that, I would open it up to any questions. Thank you so much for the time today.